Phobias have their basis in the most primitive part of the brain, which is millions of years old. And so often it applies inappropriate reactions to everyday social situations, which can seem irrational, but to the brain seem very, very real. And so an important part of phobia therapy is about getting the brain to realise that those situations are entirely safe.
According to the American Psychiatric Association, a phobia is an irrational and excessive fear of an object or situation. In most cases, the phobia involves a sense of endangerment or a fear of harm. Phobic symptoms can occur through the exposure to the feared object or situation, or sometimes merely through thinking about the feared object. Typical symptoms associated with phobias are dizziness, trembling, and increased heart rate. These symptoms may even include a sense of unreality or a fear of dying. In some cases, these symptoms may escalate into a full-scale anxiety attack. As a consequence of these symptoms, some individuals begin to isolate themselves, leading to severe difficulties with functioning in daily life and with maintaining relationships. In severe cases, the person may seek out medical care due to a constant concern with imagined illness or imminent death.
There are three main causes of phobias. These three are evolutionary psychology, negative childhood experiences, and that they are learned from others around you. The evolutionary psychology perspective states that your ancestors avoided certain things and this allowed them to survive and reproduce. This is related to natural selection and survival of the fittest. Since your ancestors avoided these things, you also do it as it can help your chances of surviving longer. The second is negative early childhood experiences. If you get bitten by a dog as a kid, you'll be more likely to develop a fear of dogs because you link that experience to all dogs and think they will all hurt you. This causes you to avoid dogs and develop a phobia. The last is that they are developed from others around you. Phobias are often learned from other people, which is related to observational learning. If you see someone scream when they see a spider, you will be more likely to scream when you see one because others are scared of it. While phobias are often developed during one's childhood, they can be developed during later years in life as well, especially if one experiences a traumatic event.
Agoraphobia is a phobia where you fear and avoid places or situations that might cause you to panic and make you feel trapped, helpless, or embarrassed. You fear an actual or anticipated situation such as using public transportation, being in open or enclosed spaces, standing in line, or being in a crowd. The fear is triggered when there's no easy way to escape or get help if the anxiety intensifies. Most people who have agoraphobia develop it after having one or more panic attacks, causing them to worry about having another attack and avoid the places where it may happen again. This picture shows an ancient agora in Delos, Greece, one of the public spaces after which the condition was named. Without treatment, it is uncommon for agoraphobia to resolve. Treatment is typically with a type of counseling called cognitive behavior therapy, CBT. CBT results in resolution for about half of all people. Agoraphobia affects 1.7% of adults, and women are affected about twice as often as men. The condition often begins in early adulthood and becomes less common in old age. It is rare in children. The term agoraphobia is from Greek agora, meaning a public square, and phobia, meaning fear.
Social phobia is the fear of social situations that involve interaction with other people. It's the fear and anxiety of being negatively judged and evaluated by other people. This causes anxiety and fear in most areas of a person's life. Because of this, it's chronic as it does not go away on its own. Only direct cognitive behavioral therapy can change the brain and help people overcome this phobia. People with social anxiety are many times seen by others as being shy, quiet, withdrawn, nervous, and disinterested, to name a few characteristics. People with this phobia experience distress when introduced to others, are teased, are the center of attention, or are being observed by others. This phobia can be treated by a specialist. Treatment must include a behavioral therapy group and later real-life situations with other people. These real-life situations help the patient learn acceptable social behaviors and gives them tactics to apply these to their real life.
Acrophobia is defined as the fear of heights. Unlike a specific phobia, such as aerophobia, which is the fear of flying, acrophobia can cause you to fear a variety of things related to being far from the ground. Depending on the phobia's severity, you may fear being on a high floor of a building as much as simply climbing a ladder. You may feel a sense of panic when you perceive that you're high off the ground. You may instinctively begin to search for something to cling to and find that you're unable to trust your own sense of balance. Common reactions include descending immediately, crawling on all fours, and kneeling or otherwise lowering your body. Research shows that a certain amount of reluctance around heights is normal, not only for humans but for all animals. In 1960, famed research psychologists Eleanor J. Gibson and Richard D. Walk did the visual cliff experiment, which showed crawling infants, along with babies of numerous species, refusing to cross a thick glass panel that covered an apparently sharp drop-off. Acrophobia, like all phobias, appears to be a hyperreaction of the normal fear response. Many experts believe that this may be a learned response to either a previous fall or a parent's nervous reaction to heights.
Arachnophobia is the irrational fear of spiders and other arachnids like scorpions. People with this feel uneasy around areas where there could be spiders, such as webs. Scientists who have studied this fear of spiders explain it to be a result of evolutionary selection. This means that arachnophobia is an evolutionary response, since spiders, especially the venomous ones, have always been associated with infections and diseases. Hence, the fear of spiders triggers a disgust response in many individuals. One view about its causation, especially held in evolutionary psychology, is that the presence of venomous spiders led to the evolution of a fear of spiders or made acquisition of a fear of spiders especially easy. The alternative view is that the dangers, such as from spiders, are overrated and not sufficient to influence evolution. Instead, inheriting phobias would have restrictive and debilitating effects upon survival rather than being an aid. For some communities, such as in Papua New Guinea, Cambodia, and some in South America, spiders are included in traditional foods. This suggests arachnophobia may be a cultural rather than genetic trait. Recent advances in technology have enabled the use of virtual or augmented reality spiders for use in therapy to resolve the phobia. These techniques have proven to be decently effective. Arachnophobia affects 3.5 to 6.1% of the global population and is more common with women.
Heliophobia is the fear of the sun, sunlight, or any other type of bright light. The Pacific Health Center says that people with this phobia have been staying away from the sunlight because of the growing fears with skin cancer and blindness. Sufferers may cover themselves with long protective clothing when going outdoors during the daytime, or simply never go outdoors at all when the sun is out, depending on the severity of the fear. When these people are outside, some of their symptoms include dry mouth, numbness, feeling dizzy, and rapid heart rate. This phobia causes them to be more prone to becoming vitamin D deficient as they are rarely outside. In addition, it has been linked to depression caused by a combination of vitamin D deficiency, isolation, and feelings of alienation from other people. On top of this, the fact that they are in a continuously dark environment causes the depression. There are steps that can be taken to eradicate this phobia. The most common type of treatment is one-on-one therapy with a psychologist. This helps because it establishes a sense of trust between the two, which causes the patient to be more prone to listen to the advice that the psychologist gives him or her. Another form of treatment is medication. Medications may be prescribed to help them manage their fear when they do try to tackle it.
Nomophobia is the irrational fear of being without your mobile phone or being unable to use your phone for some reason, such as the absence of a signal or running out of minutes or battery power. In the case of nomophobia, the events that the user fears are not terribly unlikely, so that part of it isn't irrational. What is irrational is the degree of discomfort the users feel at the thought of being, in effect, separated from their smartphones. The word nomophobia is a portmanteau made up of no, mobile, phone, and phobia. The term was created by YouGov, a research organization based in the United Kingdom. In a 2008 study, researchers reported that 53% of mobile users felt anxious when they were unable to use their mobile phones, and over half of the users never shut their phones off. Subsequent studies have found that the numbers have increased since then.
There are many treatments to phobias. First is systematic desensitization. Systematic desensitization, also known as graduated exposure therapy, is a type of cognitive behavior therapy developed by South African psychiatrist Joseph Wolpe. It is used in the field of clinical psychology to help many people effectively overcome phobias and other anxiety disorders that are based on classical conditioning. The process of desensitization itself, minus the fear hierarchy, was developed by psychologist Mary Cover Jones and is primarily used to assist individuals in unlearning phobias and anxieties, occurs in 3 steps. The first step of systematic desensitization is the identification of an anxiety-inducing stimulus hierarchy. The second step is learning of relaxation or coping techniques. When the individual has been taught these skills, he or she must use them in the third step to react towards and overcome situations in the established hierarchy of fears. The goal of this process is for the individual to learn how to cope with and overcome the fear in each step of the hierarchy. Also, systematic desensitization can be paired with modeling, an application suggested by social learning theorists. In modeling, the patient observes others, the models, in the presence of the phobic stimulus who are responding with relaxation rather than fear. Next, flooding. Exposure treatment was created by Foa and Kozak in 1986, and it calls exposure to the phobic stimulus in a safe and controlled setting because the patient is exposed to the phobic stimulus as a part of the therapeutic process. One simple form of exposure treatment is that of flooding. Flooding, sometimes referred to as vivo exposure therapy, is a form of behavior therapy and desensitization or exposure therapy based on the principles of respondent conditioning. It works by exposing the patient to their painful memories with the goal of reintegrating their repressed emotions with their current awareness. Flooding was invented by psychologist Thomas Stampf in 1967. It is still used in behavior therapy today. Although it may take several sessions to achieve a resolution, the technique is regarded as successful. Many research studies are being conducted in regard to achieving immersion therapy goals in a virtual computer-based system, although the results are not conclusive. These are the therapies that have been created to try to resolve phobias.
Spiders! Spiders! Get them off me! Get them off me! Get them off me!
Wake up! It's me! Except my glove light. Ah, that's better. This isn't your average everyday darkness. This is advanced darkness.
What is that thing?
Could you not stand so close? You're making me claustrophobic.
What does claustrophobic mean?
It means he's afraid of Santa Claus.
No, it doesn't.
Ho, ho, ho!
Stop it, Patrick! You're scaring him!
Ho, ho, ho!
It's not working, Patrick.
Darn.
Nothing's working!
Wait, SpongeBob! We're not cavemen! We have technology!
It didn't work.
Where I can be all alone.